Patients that are not at high risk, correct? Patients that are adolescents, young people in the 20s, in the 30s, in the 40s, they don't have any comorbidities that put them at high risk for COVID infections. We should still practice all the measures to prevent COVID infection. We know that once in a while, those patients, even without risk factors for COVID, they get admitted to the hospital and they require critical care. So especially to cut down the chain of transmission, to improve to actually impact the dissemination of the COVID-19 in our communities, it's important that everybody across our society get engaged with these precautions. The safest way to travel, let's say by plane, I think will be to follow all the measures that the headlines are putting in place. I think they are maintaining the physical distancing inside the aircraft, and of course we encourage everybody to follow the measures or wearing the face mask protection for that. For other type of traveling, the key factor is to avoid exposure, the contact with other people, correct? So if we are getting in contact in like other situations with people that is not part of like our families, I think it's important to keep the social distancing and decrease the exposure to people. I mean, we know coronavirus is perpetuated, this COVID-19 pandemic is perpetuated by the transmission from people to people. So if we can just cut that chain of transmission, just avoiding the unnecessary exposure to people when we travel, I think that is a great way to contribute to decrease the pandemics. So we know that there are some categories, some patients that belong to groups, for example, those above 65, patients with comorbidities, with cardiopulmonary conditions, diabetes, obesity, transplant, cancer patients. Those patients can have a high rate of complications, correct, coming from COVID infection. Now, the young people in the 20s, 30s, 40s, we are seeing less rate of complications. They develop usually an asymptomatic clinical case, or they are actually highly symptomatic. But once in a while, we see those people admitted to the institution, requiring hospitalization, critical care, because development of severe COVID infection. So there must be some genetic predisposition, also factors associated with the virus that explain that interaction and put in critical condition patients without comorbidities in the 20s, 30s, and 40s, and we are seeing that also.